As we resume the proceedings post-lunch, we move to another plenary session by Dr. Vasuki Mathivanan. We would now like to invite Dr. P.V. Padma to welcome Vasuki ma'am with a sapling.
Ma'am, please. To introduce our plenary speaker, Dr. Vasuki Mathivanan, we are pleased to invite Dr. Vidya Pujari.
A very good afternoon to all of you. Continuing with our plenary sessions, let's resume back with one more interesting session with Dr. Vasuki Mathivanan, giving you a brief account on her career story. She is an esteemed psychologist with a wealth of experience spanning over 32 years promoting mental well-being. She has extensive experience in training, teaching, counseling, and clinical supervision. Recently, she has been awarded the Legacy of Leadership by Aloha International for many years of dedication and services to children and families of Aloha. Also awarded as Top 10 Best Women Leaders in Career Counseling 2024 by Women Entrepreneur magazine. She is the first Rise Up Certified Supervisor for India. She is an EAP consultant for organizations and member of advisory board and board of studies of a few reputed academic institutes. She regularly conducts trainings and workshops for teachers, mental health professionals, managers, and team leaders of schools and organizations. She has also conducted workshops and seminars on various topics in countries like UK, Malaysia, Australia, Doha, and Sri Lanka. Having interacted with multidimensional stakeholders in the field of mental health over 2 decades, she felt a compelling need to support and monitor mental health professionals to hone their skills so that they deliver an effective therapy to their clients. This need, coupled with her association with international experts in the field of counseling and psychology, gave birth to the establishment of Indian Academy of Professional Supervisors. She is the founder and former president of IAPS. She regularly conducts Rise Up Supervisor training and has trained and certified more than 150 professionals in India and Nepal. She is also the PhD supervisor affiliated to Martin Luther Christian University, Shillong, and Wells University, Chennai. We are pleased to have you with us, ma'am. Thank you.
With that introduction said, we now invite Vasuki ma'am to address us. Ma'am, the stage is yours.
Yes, ma'am.
Very good afternoon to one and all present here. So my topic today is empowering novice practitioners to meet emerging challenges. So since yesterday morning's inauguration, you students and other faculty and other guests, you are listening to many plenary speeches and many other presentations. I feel my topic is very, very different in a way. Thank you. Yeah. So the topic or the title of the two-day conference is Exploring the Psychological Impact of Societal Transformation, Challenges and Opportunities. Transformation happens in society, which gives way to a lot of challenges and opportunities. And when clients, that is the people, the public or community, when the community faces all these challenges, how our mental health practitioners are facing and what kind of challenges it is producing among mental health practitioners, and what is the way forward to handle those opportunities. So in that way, my focus will be more on practitioners. So we have a lot of students here, faculty here, and many students, you would become the future practitioners. So in such cases, what are the ways and how you can equip or how you can prepare yourself to be a efficient therapist. So in that way, in that sense, I have chosen this topic, empowering novice practitioners to meet emerging challenges. So there are very few key words in this title. The first one is empowering. What is the meaning of empowering? Here we are talking about empowering not the community, empowering the practitioners. That's what I said. It is very different from other topics which we are listening from yesterday, right? Empowering in the sense, and yesterday I think Honorable Vice Chancellor in his inaugural address, he mentioned about the gap between theory and the practice. What is being taught in academic institutes and what is in reality practice in the in outside world. Outside the academic institution, there's a long gap. There's a big gap because the theory, what is being taught in the academic institute, that lays the foundation. That is the fundamental. So unless and otherwise you are or we are thorough with the fundamentals, you can't go to the next step. But that doesn't mean once you come out of after your PG, you, if you want to become a therapist or practitioner, yes, I have my master's and I have done my 6 years of now because of the latest NEP, it is 6 years of degree. After that, yes, now I can practice, I can start my private practice. That is what happening in our country, especially in India. Supervision is not a mandatory practice, right? So if you want, you can have a supervisor, otherwise no one is going to ask you why you don't have a supervisor, unlike in Western countries, right? So having said that, so when you say empowering and how it is connected with a novice practitioners as a beginner, how this supervision is going to guide the person or guide the to-be therapist, and also how it is helping her to build up or upskill herself, which creates confidence, and also how it creates or helps in building up strategies so that the therapist or to-be therapist can face or handle the challenges she is going to face because of the societal transformation. That is how we have to look at that. So in the title, that empowering is a very important keyword. The next one is the novice practitioners to meet the emerging challenges, the crucial role. So when we say the crucial role of professional supervision, supervision is not optional. There is no choice, okay, if I want, I can have a supervisor, otherwise it is okay, no. So what we are trying to say here is professional supervision or having a supervisor is not going to be optional and not optional, right? I will be talking about what is the latest act, National Allied Mental Health Act talks about also. So when we say crucial, it is not optional. It is very much in guidance, which is also helping you to understand what you are doing with your client, because there is no mechanism to monitor what is happening within the four walls. It is only because of lot of, we say that our profession itself is a very lonely profession. Because of the confidentiality, because it's of the sensitivity, we are not supposed to share what is being discussed with others or anyone except your supervisor. Of course, there are some exceptions when there's a harm to others or harm to self, that is an exception. But otherwise, only with the supervisor you create or supervisor is the one who creates a safe space. So since majority of students are here, student population is here, it is very important for you as students to understand what is supervision, right? So initially Miss Vidya, when she introduced myself, she said that I am the founder of IAPS, Indian Academy of Professional Supervisors. So way back in 2018 when I started that, and when I want to take more people into the organization, when I used to talk to people, especially academicians, they say that I don't think that I need this training because I am already a supervisor. Because I supervise PhD candidates, I supervise MPhil candidates, because that time we had MPhil. Now there's no MPhil by UGC. So we are not talking about the supervision which is to guide your PhD scholars or MPhil scholars. It's not about that. So especially we have to understand what is supervision. So that is the whole idea why I have chosen this topic. So having said that, what is professional supervision? Right? One of the most quoted definition by Inskip and Proctor, which is stated, given in 1995, is a working alliance between a supervisor and a counselor in which the counselor can often offer an account or recording of her work, reflect on it, receive feedback, and where appropriate guidance. The object of this alliance is to enable the counselor gain in ethical competence, confidence and creativity so as to give her best possible service to her client. So, according to this definition, as a professional supervisor, there are three important roles the supervisor has to play. The first one is the normative. What do you understand by normative? Normative is a supervisor ensures the supervisee, that is a therapist. The supervisee works within the ethical and legal norms. The person follows, the therapist follows ethical and legal norms. That is a normative. What is formative? The formative, another role the supervisor is supposed to play is normative, and then the formative is to ensure what is that the supervisor is doing so that it enhances her ongoing professional development. Because just having a master's degree is not enough. Because since yesterday you heard many people talking about what are the different challenges we face because of the societal transformation. Are we equipped to handle that? Because way back when 32 years back when I finished my master's, there are a lot of things I studied in the textbook, which I have never seen with my clients. Just be it a relationship issue. Maximum maybe a breakup or some misunderstanding with the parents and conflicts between parents and children, or conflicts between siblings, sibling rivalry, all those things. All those things, no, sibling rivalry, all related terms have taken a backseat because there is a lot of different dimensions have come into relationship issues. When now, if you want to call yourself as a relationship counselor, you have to understand what is the impact of this societal transformation on relationship dynamics and what kind of changes it has brought in. Because of that, what are the challenges your client is facing, so that are you as a therapist equipped? Maybe it is not being taught back into your academics or in your PG degrees. But are you still ready to handle that client and that issue? Who can help you? What is the monitoring mechanism here? Only the professional supervision. Because in our country, our profession is a self-regulated profession. It's not a government regulated one. So no one is there to monitor unless you are part of an organization or peak body where you have a code of ethics and you follow them. Right? Otherwise, no one is there to monitor you. So as I said, normative, formative. The third one is a restorative. And it's also a responsibility of a supervisor to ensure the supervisee is in good mental health. Her mental health is in place so that she can take care of her client, or she can deliver a good client care. Right? So that is called self-care. So when I say self-care, I also want to mention this because I have supervisees with different ranges. Supervisees who has about 10 years of experience, 12 years of experience, and at the same time they have just started their practice 1 year, 2 years. So one of the trend I see among these novice practitioners is, I have to use this term, toxic self-care. That is, this week my clientele or my workload is high. How many clients you have seen? I have seen 4 clients in a day, so 4 into, maybe if you are a person who is working from Monday to Saturday, 6 days, 6 into 4, 24 clients. It is too much for me, too much for, I need a space. So let me reschedule all my appointments. Right? So, and also they get to use the word burnout, which we are also going to talk about. So there is a lot of mixed messages to the novice practitioners, with all due respect, because they are very enthusiastic, they are very informative. I have to say that even I was telling my colleague also, like unlike our days, lot of exposure to students, they are very, very confident. Everything is very, very appreciating all those qualities. But these are the few nuances if you want to become a efficient, I'm not using the word successful, efficient practitioner. You need to understand the nuances of mental health landscape. That is where I am talking about what are the different roles supervisors have to play. Right? When I say toxic self-care, sometimes it's too much of obsession with our own self. Yes, it's a maximum I have done, I need a space. What's going to happen to the appointments that we have given to the clients? Maybe initially when the client is a new client, usually we see once a week, at least once a week. So if you are going to take 1 week or 3 days of break, then what's going to happen to them, right? So who is going to tell you, yes, I don't think it is a good system what you are following. I don't think I don't think it is a good pattern. I think that you need to work on organizing your work schedule, organizing things. Who is going to tell you? What is the mechanism available for us? It's only professional supervision. Having said that, this is a definition given by Philip Armstrong. Hope you all remember the person who has given the plenary speech in the morning from Australia. So he is a person who developed, or who is a founder of the Rise Up. That is a model that we use in our supervision trainings and supervision. So according to Philip Armstrong, in 2006 he defines professional supervision as the process whereby a professional can discuss personal. There are 4 important aspects. One is the personal. When I say personal, you can, please mind that what is given in the bracket, where appropriate and impacting on work. So when I say personal, not necessary you need to get all personal information about your client, about your supervisee. No, when it is relevant, and also professional, business. And Armstrong's model gives lot of importance to business aspect. As a supervisor, how you can help your supervisee who is a novice to start a practice. I am not talking about the private practice, just start the practice or initiate the practice. Maybe after 5 years if she wants to have a private practice, how you can, as a senior person in the industry, how you can help. And also the fourth one is industry work related. How you are organizing your schedule, is it too much or too much of work overload, all these things. So 4 important aspects. So he says that these are the 4 issues have to be discussed by the supervisor with a qualified professional supervisor who is usually more experienced than the supervisor in order to identify and resolve professional concerns and emotional issues and help the supervisor to evolve professionally in a positive manner. So this is a definition for you to understand what is supervision. Okay. So why are we giving so much of importance to professional supervision? Why do we need professional supervision in our field, mental health field? As a novice or as a senior person, there is no end to it. There is no improve my business, that could be the case. Or not necessary it has to be a clinical case discussion. But definitely having a supervisor is, I won't say mandatory because it's not a mandated practice still, but it is very, very crucial and essential, right? So again, coming back to the question, why do you need supervision? Okay, so compassion fatigue. Any one of you have any idea what is compassion fatigue, students? No? Okay, I think today or yesterday's session we were talking, the speakers were talking about empathy, compassion and all those things, right? So what is the word compassion fatigue? So, yes.
So passion fatigue is sometimes when we are caring so much for other people, we are not taking our own mental health into account. It goes to such an extent that we become numb to the feeling of, feeling any more compassion for ourselves or for others.
Okay, so partially it is true. So what do we understand by compassion fatigue is usually it happens to the therapists who in and out work with clients who come with trauma or abuses or different kind of domestic violence or different kind of violence and all those things. So what happens is over a period of time, the gradual lessening of compassion, and you don't even feel empathetic, you don't even feel compassionate towards what your client is saying. The client is talking about a child abuse, right? So as you all know that non-verbal cues are very important for a therapist, am I right? right? So there are times when the clients start talking about a sensitive issue, you lean forward, definitely you need to have an eye-to-eye contact, all these non-verbal cues are very, very important, right? So there are different ways how the therapist shows or projects a compassion to the client. The client understand, okay, my therapist is listening to me. My therapist understand what I am going through. But what happens is when you don't take care of the lot of different aspects, the compassion fatigue happens. That maybe there is no break time for you, there is very, very or no self-care aspects. So, I mean, there are so many reasons. Especially it all started in a very, in an excessive way after COVID. Because of the online thing, earlier it is very rarely we take online sessions, am I right? See, Mumbai means Mumbai therapists get to see clients from Mumbai. Very rarely those days it's only Skype. We used to have online session with US clients or Europe clients, very, very rare cases. But after COVID, during COVID it all started, the online therapies become very, very popular and become very, very essential. It is part of every therapist work schedule. In a way, there is a lot of advantages, but as everything has a pros and cons, this has a lot of cons also. Consequences. What are the consequences? So what happens is, even Sundays, sometimes when you get a client's call or client's message asking for an appointment, you are okay to give because there is no need for you to travel. You can sit comfortably in your home. And now we have Zoom, we have all the facilities, you can blur your background, everything, so there's no need for you to have a very professional setup, so you can have online. So especially when there's differences in time zones, it could be the time where you are supposed to sleep. So there are so many ways it gets affected, right? So compassion fatigue is very, very prevalent, especially among novice or beginners. And also the vicarious traumatization. Any idea what is vicarious traumatization or vicarious grief? Okay, I'm not going more deeper into it. The vicarious traumatization or vicarious grief is again, it is one form of countertransference. You all know what is transference. This is one form of countertransference. You own your client's problem. You feel, no, this is my burnout. Lot of studies used to be there, research studies, but now the burnout sets in very early. Maybe within 1 year's time, within 6 months of you starting your practice, because of overworkload or so many factors, right? So burnout and insulate from work-related stress, right? And also legal action and malpractice. Yes, as I said, that it's a self-regulatory profession. There is no monitoring, I mean, there's no mechanism to monitor unless you are part of an association, and a lot of malpractices that you don't hold that qualification, but still you advertise that I have this. I mean, we get to hear and we get to see many people give the prefix of DR, doctorate, without having the proper educational qualification. So all these things are happening. So suppose, and also there's a lot of online trainings are happening. That is also again another opportunity, but how you are making use of it, how you are using that and advertising yourself is very, very important, right? So that all these things are, I mean, you can get trained, but are you eligible to be a trainer? Just 3-day online training will not qualify to become a trainer, right? So all these things comes under malpractice. And also transference and countertransference that I am sure that you all know. So these are the potential risks faced by mental health professionals, right? So who is going to help you to come out of it? Who is going to tell you, like, looks like the way you describe things, looks like you are reaching burnout. You are totally exhausted. I don't think that you are eligible to do CBT because I don't think that, I don't remember you telling me that you got trained in CBT. Who is going to tell that? Only the supervisor can do, because who is the supervisor? A senior person in your own field. When I say senior, it doesn't mean only the age and years of experience. That doesn't give or that doesn't guarantee the person is very objective in all her practices, agendas and her own mental health. But when a person, a senior person is able to reflect what's happening in the practice and able to bring her experience into her practice or her with the client, that is when when we say that, okay, she is a professional supervisor. That is where we always use the term clinical wisdom, which is very closely associated with professional supervision. What is clinical wisdom? Is there any difference between when we say that you are very clever and you are very wise? There's a difference, right? Clever and wise, are they same? Okay, so wise is very much different, because when you are able to, I mean, you have your experience, and when you are able to apply that, that is when you become wise. Same thing. You have studied everything in your PG or UG. Are you able to apply that? Do you have the right skill set? Have you keep upskilling yourself? Right? So that is where you say that, yes, I am becoming more wiser and wiser in applying. When you handle the first client who is experiencing anxiety, and maybe after 6 months you are going to see another client with the same anxiety, you can see the difference how you handle that and how you are handling that. Right? So are you able to understand that difference? That is what we say, that we become more wiser with years of experience and number of clients we say. So what is the context of supervision in India? If you see all Western countries, even in the countries in our region, Asia Pacific region, it is a mandatory practice. People are very proudly say that I have a supervisor. My practice is being supervised. But how many of us are okay to tell that I have a supervisor? Because it reflects that maybe this person is not very confident, that's why she has a supervisor. I always tell my supervisors, when you get the informed consent signed by your client, just add one line that if needed, I will discuss this with my supervisor. That is very important. So that doesn't mean that you are lack of confidence, or I mean you are not confident about what is that you have to do with your client. No, that reflects the safety net is very good. It is intact. Because in Australia, I mean I am more familiar with Australian norms because I was trained there. I was trained by Dr. Philip Armstrong, and I know the practices there. They are very happy to say, and clients are very happy to, and the first question they ask is, who is your supervisor? And if you want to if you want to retain your membership with the professional association, you need to upload your supervision hours. That is a practice, but in India things are not like that. But now after this National Commission of Allied and Healthcare Professional Act 2021, which insists the regulating and maintaining standards, especially maintaining the standards in educational institutes and all those things, and they talk a lot about concept of supervision. It very strongly suggests in the act, it strongly mentioned that every academic institutes or every organization should have the provision for providing supervision. So that is a very good message. So when I started IAPS, it was not there, but the amount of encouragement and amount of responses we received from throughout India, that really, really motivated us to expand the services. And 2021, this act came into place, and it is the acts very strongly support supervision, and they said you have to have supervision, provision for supervision in all academic institutes and organizations, right? Okay, so I just want you to have this clarity. What could happen when a novice or beginner practice without supervision and without supervision? I just want to show that difference, right? So the background of the therapist, Ria, she is the therapist, is a 24-year-old psychology postgraduate who has recently completed her master's degree. She has not received formal clinical training, underline that, clinical training, supervised practicum or licensure. wanting to gain experience, right? Wanting to gain experience, she begins offering online counseling, which is very easy. There's no need to register anywhere or need to register in any platforms, nothing. So you can, just like that, you can start. Online, gain experience, she begins online counseling sessions independently, advertising herself as a mental wellness coach. I am sure that those who are, I am sure all the students should be having Insta accounts, right? So Insta, it's very popular thing, mental health wellness coaches, mentors, or different nomenclature they are using. So RIA does not engage in professional supervision, believing that theoretical knowledge and self-learning through social media and podcasts are sufficient, right? Again, this is also another pattern. So, no, I listen to so-and-so podcast and I know that what is happening. So, they are familiar with all these fancy terminologies. Lot of fancy terminologies are in the social media. So, students, not students, novice, beginners are very clear about what is that and what does that mean, and so they are very articulative in that manner. So she gets a profile, she gets a client, and the client profile is, the client Anita is a 29-year-old woman. So please see the difference. The therapist is 24, the client is 29, but it doesn't matter. It is okay to see elder, younger, it's okay. But only thing is, are you equipped to do? That is what we are seeing here. So 29-year-old woman working in a corporate firm. She seeks help for persistent anxiety, disturbed sleep, frequent crying spells, and feelings of worthlessness after recent breakup and workplace stress. It is a real scenario which happened, but of course, I de-identify the client name and other things. During the first session, Anita discloses occasional thoughts such as, sometimes I feel it would be better if I didn't wake up. Right? This is a statement she does. So, 2-3 sessions happening. What happens after? The outcome is Anita's symptoms worsen over the next few weeks. She feels misunderstood and guilty for not improving. There is no improvement after 4 sessions. After 4 sessions, there is no improvement, no symptom reduction. Eventually, she has a panic episode at work and is taken to a hospital where she is referred to a senior trained psychologist, right? So, you don't know what has happened in between, right? What are the gaps? So, what is a therapeutic process and what are the gaps happened here? And you all, you already know the profile of the therapist. She is a new therapist, novice, beginner, and whose work is not being monitored or supervised, right? So, what are the gaps? Inadequate assessment. So, what happened is, there is no structured intake or risk assessment done in spite of saying or talking about the symptoms, right? Lack of, and also there is no screening for depression or suicidal ideation, nothing. Because if you remember, what is the last sentence? 1 minute. Okay, so she says that eventually she has a panic, okay. So she says that sometimes I feel it would be better if I didn't wake up. So what does that indicate? It is a passive death wish, right? So immediately the therapist should rule out few things, so the screening is not done. So, inadequate assessment and lack of ethical awareness, and believe me, the informed consent is not signed. Right? Boundary limits were not explained because confidentiality limits were not explained or not this thing, because there are 2 exceptions where we breach the confidentiality. What are those 2? One is harm to self-harm and harm to others. So, what is, this comes under which? Self-harm, right? So, the confidentiality, so there is no confidentiality maintained, and she has not maintained the records that are case notes. Because case notes are very important for a supervisor to go through and analyze and understand where the gap and what happened, even that is not happened. Inappropriate intervention. So what happened in the second session itself, she started saying that, no, start doing a gratitude journal, and it's a very normal stress. Why do you want to stress so much? It's very normal. So she normalized everything, right? And another important thing is an online session, right? And boundary violation. So what happened is, so after the first session, this client started messaging her because the therapist said that anytime I am available, you can contact me. So all midnight messages and everything, the boundary is not set. And also she started, she also shared apologies, and of course she was referred to a psychiatrist also, right? So you can see what are when you understand or when you listen to your client, it looks like, okay, I think I can manage. But there are many times that you can't manage as a beginner, because you have to consider multiple things which you fail to do because you don't have the experience. So you need someone who can handhold. It's hand-holding in the sense, not everything. Initially, yes. Initially, we always encourage and motivate beginners to have at least once a week session. Right? So now you see what is the difference. This is a untrained novice therapist. Still the person is not trained, but with professional supervision. So Arjun is a 25-year-old postgraduate psychology student who has completed his theoretical coursework but has limited clinical exposure. That is where he comes under non-trained, untrained. He is currently seeing clients only under a formal supervision arrangement. So he is seeing clients only with supervision at a community mental health center. Arjun meets his supervisor, a trained psychologist, weekly and follows institutional protocols for documentation, referrals and ethical practice. Right? So who is the client? The client, Meena, is a 32-year-old married woman working as a school teacher. She seeks help for persistent anxiety, irritability, sleep difficulties and feelings of inadequacy related to work pressure and family expectations. In the second session, Meena shares, some days I feel emotionally exhausted and wonder what's the point of everything. This is where the therapist got, the beginner got confused, because he was not very sure whether it comes under depression, because the symptoms are kind of overlapping, right? So what is the outcome? I'm going to talk about the therapeutic process, where before that the outcome is Meena reports feelings heard and supported. The heard and supported is very, very important. If you recall what Dr. Philip said today, he said that first 5 minutes script between the therapist and the client is very, very important. That is what going to decide whether you are going to win the client or lose the client. That is very, very important, the first 5 minutes script. Right? So that is where we talk about information gathering, rapport building and all those things. There are beginners who don't even spend time on rapport building. Immediately they go into suggestions or interventions, which is not going to help the client. Right? So Meena reports feeling heard and supported. While her stresses continue, her coping improves and sleep stabilizes. When symptoms plateau, the supervisor and Arjun jointly decide to refer Meena to a more experienced therapist, explaining this transparently to the client. Right? So when you want to refer, even that has to be done in a very systematic way. So here the therapist, the novice therapist is doing with the help of the supervisor. So what happens in the therapeutic process? Initial assessment and supervisor consultation, where the supervisor able to help the supervisee to understand the difference between stress-related exhaustion versus depressive symptoms. There are times it is overlapping. So initially as a beginner, you will not be able to understand when your client says that I am very anxious, I am not able to sleep. I feel what's the point, what's the use of me doing this? So you get confused, does he go into the mode of depression? So here the supervisor takes time and make her to understand the difference between stress related exhaustion versus depressive symptoms. Then ethical practice supported by supervision, as I said, informed consent, confidentiality, maintaining the records. That is very important. Intervention planning. So what is a proper intervention? So every step, this supervisee is taking the help from the supervisor. That makes lot of difference. That makes lot of difference on what? On the client. So, okay, I'm skipping this one. So, when we say the role of a professional supervision, always remember this diagram, right? So, this triad talks about supervisor, supervisee and client. Always there is a direct contact between supervisee and the client, and supervisor and the supervisee. There is no direct contact between supervisor and the client. It is like a third party duty of care, third party insurance. Right? The supervisor ensures the client is given the right care through supervisee. This is the whole, put it in a nutshell, this is the crux of this, what is professional supervision. Right? So what's happening? Going back to the topic, the societal transformation which has made rapid technological advancements. As I said, that online session which was not prevalent at all when we started our practice, which is very much prevalent nowadays. There are beginners, they don't have a office space or anything, they do only online. So you need to be double careful, right? And also changing client expectations. Clients come to you with lot of expectations, saying that, asking that, are you trained on ACT? I want a practitioner who practice ACT. I want only CBT. So their demands are very, very high, because they Google, they get all information and they come to you, unlike those days. So are you ready? Are you equipped to handle those challenges? And this next one is new regulatory and ethical requirements. As I said, that National Allied Mental Health Act talks about supervision. So there will be a time like you have to, all your data, all your profile, you have to mention, yes, I am under supervision and I am doing supervised practice, right? And increase workplace complexity, right? Okay, and what is a supervisor function? It's both educational and supportive. As I said, it is educational, it is a forum where you get the right support to understand your client and provide the right clinical intervention. At the same time, you as a person, you as a therapist, your self-care is also monitored by your supervisor. So in that way, it is both educational and supportive and empowered. Who is an empowered novice practitioner? The person who is increased confidence and professional identity, enhanced problem solving and decision making abilities, better adaptation to societal changes. You don't complain. You don't say that, so many problems and what is this and all that. You don't complain. You are adapting yourself to all these societal transformation. And higher levels of competence, independence and resilience, so that you don't reach the stage of burnout or compassion fatigue or vicarious traumatization. Yes, we are human beings, we undergo when there's a loss or personal loss, or when you go through grief, yes, but are you okay to take support? Are you okay to take therapy? There are many beginners, they are very happily, they say that I am also under therapy. In a way, it is very, very helpful. But are you able to strike the balance? That is a challenge. Right? Because supervisor is a person who understands that, and the supervisor also advises you, I think it's a time you need to take a break, then you have to come back to your practice. Supervisor is the only person who can tell that because of her experience and expertise. And the stronger commitment to ethical and reflective practice. Right? There are times you feel that I have not done a good work with my client today. Right? So there are two ways. You can brush that under the carpet and it's okay, I have done my best. Or there's another way, you sit back and reflect, where did I go wrong? What is the gap? What is it I should have done more? Or what is it I should have done differently? Are you able to do the reflection? Do you have that openness? The previous speaker, she was talking about parenting, and there were a lot of questions about parents, why they are sending their children for the extracurricular activities and all. Are the parents, are they open for suggestions from their children? Likewise, so when I say supervisor, it is not that supervisor is the person. That is why I said there's a hierarchy. Supervisors will have their own supervisors. There's a training conducted by ACA, Australian Counselling Association from Australia, which certifies you as a supervision to supervisor. So it's an ongoing process. That is what I am trying to tell you. So the significant benefits: minimize risk of practicing without training and supervision, understand ethical and legal implication, supervision enables safe practice despite limited experience. You may be a beginner, that is okay. When you are in the safe hands of your supervisor, you can still practice, but with the support and with the supervision. Supervisors help translate theory into ethical action. Risk management is strengthened through consultation. Supervision, emotional containment for therapist. Are you able to hold yourself? When you are always ready to hold your client, are you also able to hold yourself? Supervision helps that. Okay. So when you understand what is professional supervision, it is very important. You have to understand what is professional supervision is not. Supervision is not counseling. You are not going to do therapy work or counseling with your supervisee. You are not going to provide any training. You are not going to be a trainer to your supervisee. Looking over the counselor's shoulder, just finding fault because of the hierarchy or because on the authority that you have, you are not going to look over the counselor's shoulder and find fault. And we are not there to build mini-me's of, okay, it is working for me, okay, it should work for you, you do this. I have done this course and it is very effective, so you also do that. We are not going to, you can give suggestions. I mean, you are always welcome to do that, but we are not going to build mini-me's. So when you talk about professional supervision, there are many people think that by default, after a particular years, you become a supervisor. It is not so. Because there is a lot of things you have to understand the difference between what is counseling and what is supervision. Right? Supervision training is very important. You have to be trained. If you want to practice CBT, you have to undergo CBT training, right? You can't say that I have finished my master's and I have studied, there's one chapter on cognitive behavioral therapy, so I can practice. No. You have to undergo a training so that you know how to apply the concepts and how to apply the techniques. Same way here. So the supervision training, supervising without training gives message that any good counselor will be good supervisors. That is not so. You can be you may be an excellent counselor. It's not necessary you have to be an excellent supervisor because it has entirely different skill set. Supervision skill similar but not identical to counseling skill. Supervisory training provides supervisor with framework to conduct and evaluate effectiveness of supervision. So having said that, the model what we use in our training is called Rise Up model, right? It is an acronym. It is an acronym. R stands for review, I stands for information, S stands for support, E stands for education, U stands for self-care, you and me, P stands for practice. I know many of your students, you yet to come to this stage of training and all, but this is an information given to you. You should understand at this point, because we very closely work with practitioners and also academic institutes. One of the reason is PG students, when they go out, one of the questions they ask is, yes, I understand supervision is very important. Where do I get my supervisor? How do I identify my supervisor? So look for supervisors who are trained on that. I am not saying only Rise Up, right? But as far as I know, in India, only Rise Up is the supervisor training provided so far. So identify, look. Yeah. Yeah, so I think I am done. I am happy to take, if there are any questions.
Good afternoon, ma'am. Thank you so much for your session. Ma'am, in the context of having supervisors, do you think that let's say for example, a practitioner has a disagreement with their supervisor, do you think that their advice will take precedence because they have a greater field experience, or they should also consult other professionals in the same field? And how important is it to have multiple supervisors in this scenario, especially when it comes to complex ethical situations?
Okay, so I will turn around and ask you the same question. What is your opinion about a client having multiple counselors? Maybe I have an issue of anxiety, performance anxiety. So I consult 3 to 4 counselors. Do you think that will work?
It might cause confusion.
Exactly. So same thing happens with the supervision also. It is always better to have one supervisor, right? One supervisor. But there's a difference between having a professional supervisor and a training supervisor. That is a different thing. But professional supervisor is the one who looks at the issue with the holistic perspective, right? So if there is a disagreement, supervisors are trained in such a way how to negotiate the disagreement. Right? So usually usually the trained supervisor, they don't bring their ego or anything. So suppose if they find a very much valid what the supervisee says, the therapist say, you have to agree that. So the disagreement, how to resolve the disagreements, there's a way to handle, and we are trained on that. So if you go to a right supervisor, I don't think that will become an issue, or either way. So she will agree, or she will help you to understand why she disagrees. Right? So what is the middle path? Is there any way to negotiate so that you are okay to take that, or you are satisfied with what is being suggested by your supervisor? So, but we don't encourage supervisees to have multiple supervisors. That is going to give a lot of mixed messages.
Thank you, ma'am.
Thank you so much, ma'am, for that enriching and insightful address. I'm pretty sure we all have a lot to look forward to in our future. We would now like to request Dr. P.V. Padma to felicitate Vasuki ma'am with a memento to showcase our appreciation.
We now transition to technical session 3. To welcome our session chair, Dr. Kirti Pai, we request Dr. P.V. Padma to welcome her with a sapling. Now, I would like to call Nibedita to extend a brief welcome and introduce Kirti ma'am.
Good afternoon, everyone. It's my honor to introduce Dr. Kirti Pai, a distinguished clinical psychologist with over 18 years of experience in the field of mental health and psychological services. She holds an MPhil in clinical psychology, an additional MPhil in student counseling, and a PhD in psychology, underscoring her strong academic credentials and clinical expertise. She currently serves as a consultant clinical psychologist at Apollo Hospitals, Grims Road, Chennai, and Apollo Children's Hospital, where she is engaged in psychological assessment, neurocognitive evaluation,